first time somebody scans a horse, it's going to take an hour and a half.
Right, yeah.
By the time somebody, like if you have a lot of horse experience, by the time you've done it 4 or 5 times, if you're not talking to a crowd explaining it, and you're just going to do it. This is about a 30-minute process.
Yeah.
If a horse has a lot of points and he's big, it's a 40-minute process.
Right.
If it's got fewer points or it's small,
right,
it's a 20-minute process. Once we've found the problems, now we want to start treating.
Okay.
So what she's treating with is pulsed red and infrared light. It came from laser therapy, but this is not a laser. Right. This is LED. Okay. LED is safer than a laser. It is more effective than a laser, and more importantly yet, it doesn't have any of the risks that a laser does. You can't use a laser around eyes; it'll burn the retina. This, if it burned the retina of the eye, I'd have been blind years ago.
Yeah.
It doesn't burn. It couldn't burn through wet toilet paper. Okay. Also, the light is absorbed from an LED much faster than it is with a laser. So this can do in 20 or 30 seconds what a laser might take 2, 3 treatments to do.
Okay.
This also can be used on infections with phenomenal results.
Okay.
And, as I'm doing with one of my horses at home right now, if you have melanoma or anything like that, you can treat this with the light. You cannot treat it with a laser because it'll cause it to grow.
Right.
Now, this is a unique unit because if you want to show her the screen for a second so she can see, most laser or LED units have 7 frequencies they can use, cleverly numbered 1 through 7. 7 being the most sedative, 1 being the deepest penetrating. So, in this situation, this equipment gives you 3 sets of numbers. Right. Top one being a frequency, bottom one being a time.
Right.
These units only need 20 seconds per spot to help change tissue, especially soft tissue. Now, if you were getting into a tendon, you'd want to bump that up a little bit. Okay? If you were doing a fractured pelvis, which is way inside the horse, you'd probably want to use 2 minutes.
Yeah.
And this will do 20 seconds, 30 seconds, 1 minute, 2 minutes, 5 minutes.
Okay. And those are the only increments, or you can
those are the only increments.
20, 30,
right.
1.
The ability to turn this, like if we were trying to really turn this horse around right now, I would put this on probably 5 for 20 seconds and 3 for 20 seconds. And it will run this, then it will switch over and run that automatically.
Okay.
And if you put this one on 0, these two can be set to 0. If you set this to 0, it won't do anything. It'll just run this one over and over.
Right.
But it automatically will run 1 or 2 or 3 different frequencies, which speeds up the healing dramatically.
Okay.
And it's time efficient.
Okay.
Let's put it on 20 seconds, and let's go to this. Okay. We'll start it. Okay. Are you connected up there? Okay. Now what she's going to do is, it looks like half the lights are lit. They're not. They're all lit, but infrared you can't see.
Okay.
If you had a cell phone camera or a video, a TV, digital camera, if you look through the viewfinder, you will see them all lit up. Okay. All right. Just put one light on those two, and one light on that one. Now, while you're treating, look for the next nearest spots, like here, here, here. So when the light goes beep, when the thing goes beep, beep, beep in a few seconds, move this one down there and this one over here. And then look for your next spots, and you're just going to keep treating as I keep standing away. Okay? Now, we got some readings down in here, which is very common because of girths on saddles, also because of the muscle structure in here, the way the horse moves his legs and stuff. But along the rib cage, there's really not a lot in the rib cage of a horse as far as anatomical structures. There's none of the major muscle groups here, so it's bone, a little bit of skin.
Yeah. What's the difference in the frequencies and applications?
The lower the number, number frequency 1, the deeper it penetrates and the more stimulating it is. Okay. It sounds backwards because you think the higher number is, but if you think about 7 is a high frequency, so it's kind of like and it kind of takes the pain away. 1 is like boom, boom. So it's a much deeper penetrating impulse. Okay. So if you're dealing with a more dense tissue, you'd want to go with a lower number. Okay. If you're dealing with something like a fractured pelvis or a shoulder issue that was very, very deep and not going away, you might want to get in there and deal with something with a little bit lower frequency. Okay. 5 and 3, you could refer to them as generic frequencies. Right. And I will tell you to be upfront. If she put this on, let's say, 5, and she treated every horse every place, day after day on 5, she will get decent results. But if she were to learn to use different frequencies for different applications, she could improve the efficacy substantially. Now, do you see he's feeling that shoulder, isn't he?
With the
And
fork.
both horses were very big and somewhat nervous, agitated horses. And it was really neat to watch this on a horse whose head I could hardly get it on.
Right.
And in 20 minutes, 15 minutes, his head was down, his eyes were soft.
I remember how that horse Beckett, after you worked on his neck, just took
Oh,
a big shake
yeah.
and he adjusted his spine. We heard it.
Oh, you heard the big pop, yeah.
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 Yeah. It was very cool.